is your leg pain decreasing, right? Is the leg pain centralizing? 3 exercises for self-decompression routines that you can do at home to help relieve your sciatica leg pain fast. If you want your sciatica leg pain to calm down fast, without drugs, without waiting on an appointment, and without guessing what stretch actually works, you're gonna love these 3 decompression moves. When sciatica flares, most people feel stuck because it seems like there's nothing they can do from home to shut it down. You know, they try stretches they see online, but are never sure if they actually are decompressing the spine and targeting the lower lumbar nerves, or potentially just stretching randomly. Now, this creates fear of making the pain worse. Hi, I'm Dr. Tam, chiropractor here in San Jose, California. Now, in this video, I'm gonna walk you through my 3 favorite spinal decompression moves. Now, these are the same decompression moves I teach my patients here in the office. And I will show you exactly how to position your body, where you should feel the stretch, and how to know if you're doing it safely so you can get relief from sciatica within minutes. Now, I've been recommending these exact same decompression moves for over 20 years, and they have helped provide relief for thousands of my patients. Now, these are quick, simple movements you can do at home with little to no equipment. They are designed to decompress the spine and reduce pressure on the lower lumbar nerves, including the L4, 5, and S1, which feed into the sciatic nerve. Make sure to watch till the end because each one of these targets sciatica from a slightly different angle, and exercise number 3 usually gives people the most relief, almost immediately. The first exercise in this 3-part sequence is called the prone exercise ball decompression. Now, you're gonna need a gym ball, and I recommend using a larger size, typically between 23 and 26 inches, so your body is properly supported. Now, I have dropped a link in the description where you can see the type of ball that I recommend. We are using the gym ball to create a gentle decompression effect in the lower back. And this is one of the easiest and safest ways to do that at home. Now, the goal here is not aggressive stretching. The goal is to allow gravity and positioning to help decompress the bulging or herniated disc at L4-5 and L5-S1. Now, those disc levels are the most common sources of nerve irritation that trigger sciatica leg pain. By unloading the pressure in this position, we are helping to reduce irritation to the lower lumbar nerves that feed into the sciatic nerve. This position should feel relieving, not forced. If you feel sharp pain, increase in leg symptoms, or discomfort, stop and adjust the position before continuing. Hey guys, so remember, exercise number 1 is the prone exercise ball decompression. And this is the ball we're talking about, right? So this is just your regular exercise ball. And again, I have a link down in this description if you need to find a ball, if you don't have one. But this is super easy. All we're gonna do is you're gonna get onto the floor like this, and we can maybe start like this and just kind of bend over the ball like that. And what you're gonna do is you're just gonna roll forward, right? And then you're gonna get onto your tippy toes back here like this. So we're gonna get onto our toes. Now, if you want, you can go shoulder width apart to get a little bit more balance. Obviously, if you've done this before, you can get a little closer, but obviously let's get a little bit more of a balance by putting our legs shoulder width apart. Hands in the front here just for balance. And what we're gonna do is you're just gonna let this part of your back and your legs just to flow down to the ground and have your head in a neutral position like this. So since I'm showing you, I'm gonna lift my head up. But when you're doing this, you just wanna have your head down in a neutral position like that. And you know, in this position here, if you just really just let this back and your legs relax, you may find that's enough. And if that is, and you're getting less sensation down your legs, fantastic. Hold this stretch here for about 15 to 30 seconds. If you feel it's helping more, you can hold it for longer periods of time. That's fine as well. Okay? So again, if this is fine, great. Just hold it right there and just let gravity and your legs drop to the ground to open up that space. Now after a while, you may find, hey, you know what, let me do a little different movement. And there's 3 different movements that you can do. So the first one is, in this position, you can rock back side to side, just like that. Rock back side to side. This is going to help individuals who have more of a one-sided leg symptom, and then just going to help to move things around and shift that disc material. Now, if that feels great, just do a couple of these repetitions, 10 to 15 times back and forth. You can do 2 to 3 reps. And again, after that, just lay here and let the ball drop. Okay? So the second thing that you can do is, you can do a pelvic tilt. And for those of you who don't know, the pelvic tilt is going to be just pushing your hips in through the ball like this. Okay? So again, pelvic tilt into the ball, hold and relax. Pelvic tilt into the ball, hold and relax. And again, do that 15 to 20 times. Okay? Again, 3 to 4 repetitions. The next thing that you can do, and this is the third thing, is you can do circumduction or moves, circle moves around the ball like this, going one side, and then you can go the other side. Circle moves. Okay? You can also combine the circle move into a pelvic tilt, back into a circle move, the opposite direction, into a pelvic tilt, and doing that type of repetition. And you're going to find the movements that actually help. So run through these 3 different movements and see which one provides the best relief for you. Okay? And again, even if you're just like this, that's perfectly fine as well. All right? Hope that helps. If it doesn't help and it creates more pain, just like we've always talked about before, stop the movement, rest, change position, and then try again. The second exercise is the standing side glide. Now, this is an important decompression movement because it can be done anywhere, at home, at work, and it requires no equipment at all. Now, this exercise is especially helpful when sciatica leg pain is coming from a disc bulge at the L4-5 and L5-S1 that are pushing to one side and irritating the nerve. Now, the standing side glide helps to shift the spine in a controlled way so that pressure is reduced on the affected side. The goal is to relieve sciatica by directly targeting the nerves that are being compressed on one side of the spine. Now, this is not a stretch and it should never be forced. The movement is slow and controlled and precise. You should feel mild pressure or tension in the lower back as you glide. In many cases, the leg symptoms will begin to ease or move back towards the spine, which is a positive sign that pressure on the nerve is being reduced. Now, you should not feel sharp pain, increased leg pain, or worsening symptoms during this movement. If symptoms increase, stop, reset your position, and reduce the range of motion before continuing. Now we have exercise number 2. It's the standing side glide. And I'm going to show you how to do it next. So what we're going to do, guys, is we're going to go ahead and stand up against the wall. Now, the important thing is this. If you're having, for example, right-sided leg pain, you want to have the good side facing the wall. So just remember, good side facing the wall, okay? So you're going to step about a foot away from the wall. Go ahead and put your shoulder and your forearm lean against the wall and make sure there's no gap. So basically we're not doing this, okay? So make sure that you're nice and flush, forearm with your shoulder up against the wall, okay? And what you're gonna do, hand on the hips, and we're gonna slowly drive the hip towards the wall. And so it's a light push. We're not pushing all the way through very hard. It's just a very light pressure that you're pushing, and you're gonna go just a little bit, maybe 25% of the way, and then hold it there for a little bit. See what that does. Now, if you're getting a release in your leg pain, fantastic, that's all you need to do. And if you want to go a little more, then we go maybe 50%. Hold that there for a few seconds, see how that feels. And if you want, and you want a little bit more relief, then you go push all the way into the wall here and hold that there. Now you want to hold this stretch for about 15 to 30 seconds. And during that time, we're looking to see, how does your leg feel? Are you getting a release, or what they call a centralization of the leg pain going down back into your back? And then slowly come back up. That's one repetition. You can do 3 to 4 repetitions. Again, push in 25%, see how that feels. You want to go a little more, 50, 75, and all the way into the wall. Hold that 15 to 30 seconds, 3 to 4 repetitions, come back up and see how you feel. Okay? And remember, good side towards the wall. If you have right-sided leg pain, opposite, you've got left-sided, right side towards the wall. Opposite way, lean into it. Good luck. The third exercise is the supine hip hammer stretch. Now, I chose this movement because it allows you to create a strong but controlled decompression effect through the lower lumbar spine using your own body weight. Now, what makes it both effective and safe to do at home is that the goal of the exercise is to reduce pressure on the lower lumbar nerves by allowing the pelvis to gently drop and create traction through the spine. Now, this helps calm the nerve irritation and can provide noticeable relief in the leg. You should feel a deep, comfortable decompression or pulling sensation through the lower back and hips. Now, in many cases, leg symptoms will begin to ease or feel lighter as the pressure is reduced. You should not feel sharp pain, pinching, or an increase in leg symptoms during this movement. If discomfort increases, stop, adjust the position, and use additional support before continuing. Here we go. Exercise number 3, the supine hip hammer stretch. So this stretch here, you can use any firm table or some sort of chair or bed that you can actually lay on top of, but it's got to be sturdy, okay? Because it's going to be supporting your weight. So I'm going to use this bench here. So figure out what do you have at home that you can use. But remember, make sure it's safe, okay? So what you're going to do, we're going to go ahead and sit on the thing that you're going to use, okay? And you're going to scoot forward. And what we want to do is we want to have your waist right here needs to be on the edge of the table, okay? So I'm going to put my waist on the edge of the table, and then I'm going to lay on back, just like that. So as I lay on back, you can kind of see what's happening here. And again, you can put your feet shoulder width apart. You can get them closer together if you like, whatever feels best for you. And at this point, you're just going to allow your buttocks to drop. And as it drops, it's going to help to decompress and open up the space. And this is around the L5, S1, okay? So now in this position, I'm looking at you guys over here, right? But what I would like you to do is just to have your head back, nice and relaxed, neutral, and just allow gravity and the weight of your buttocks just as it drops down to decompress the spine, okay? You want to lay here for 15 to 30 seconds. Don't go too long in this position because your body, the muscles can react to it. So 15, 30 seconds, and then come back up, okay? Now, 3 to 4 repetitions on this, and that's going to really help to decompress the lower back. Now, let's say, for example, you want to get a little higher on the spine. Well, just scoot yourself down. Scoot yourself down a little bit. So now we're getting up to like an L4, L5, and the same premise. You're going to allow the hip and the buttocks to drop and relax your head back up on the table like this. And again, 15 to 30 seconds, just hang out here for a little bit, allow that area to decompress and feel to see if your leg pain is decreasing or not. And again, you can go up a little higher if you'd like, right? So you go all the way up and then again, just let it drop like that. Okay, 3 to 4 repetitions. With this, again, 15 to 30 seconds, holding that position, and look to see, is your leg pain decreasing, right? Is the leg pain centralizing back into your back? And that's a good sign. And hopefully this helps. Again, if it doesn't help and it actually causes you more pain, that's okay, just don't do it anymore. Stop, rest, try it again later. And if it helps later, fantastic. If not, maybe this move is not for you, okay? Good luck, I hope you guys get better. You now have 3 exercises for self-decompression routines that you can do at home to help relieve your sciatica leg pain fast. Now try these out. Let me know in the comments which one gave you the most relief. Was it the prone exercise ball decompression move or the standing side glide? Drop a comment and let me know. If you got relief in your leg pain from these decompression moves, like and share this video so more people dealing with sciatica know that there are safe things they can do from the comfort of their own home to calm down their symptoms. And remember, subscribe if you want more guidance on how to protect your spine, understand your condition, and learn the treatments that help people get long-term relief. Now, I post a new video every week. The next video you should watch is the one linked here, where I talk to you about the top 10 targeted exercises for an L4-5 and an L5-S1 disc bulge and back stability. And if your sciatica is coming from one of those disc levels and you want exercises that match the problem, go watch that video next.